Hi everyone, Gift for Good is officially here and I hope you are as excited as we are. We wanted to make sure that our donors are able to give with confidence, so we've put together a couple of videos showing you the clinic, telling you about what we do. Today I want to introduce you to our staff so you can see the people who are behind putting medicine on mission. So we're going to walk around and I'm going to introduce you to the MLK team. So the first people I'm going to introduce you to is our team in the front office. First we have Miss Angela. Miss Angela is our records manager. MLK is old school, so all of our charts are paper charts. And so she plays a very vital role in making sure that after clinic, all of the paperwork is processed, all of the charts are updated, so that when clinic rolls around, everything that we need in the charts are in its proper place. It's been checked off and signed off on, and we're ready to just jump into that patient care. The next person I want to introduce you to is Miss Sue. So if you are at all familiar with MLK, you're probably familiar with Miss Sue. She's one of our health advocates here, and she's really kind of that first response with our patients. So she gets them enrolled when they're new patients. She's the first person they see on clinic day, getting checked in, getting their vitals. She helps them navigate any questions that they might have with the doctor. She checks in with them in between appointments. If they have any issues, our patients know that they can always pick up the phone, call Miss Sue, and she's going to get them taken care of. So she is just an incredible asset to not only our team, but our community, and we're so glad that she is a part of MLK. So our next stop is meeting Mary Lou and Scarlett. They are our Latino health advocates, and they play a very similar role to Sue. So they help enroll new Spanish-speaking patients. They're that first response on clinic day. They're the ones checking in our Spanish-speaking patients, helping them navigate any questions that they might have with the doctor, and then checking in with them between appointments. So if you know of anyone in the community that is uninsured and needs health services and are Spanish speaking, we would love to connect you with Mary Lou and Scarlett. Now I'm going to introduce our clinic manager. This is Brenda Mims. You will see her on the floor on clinic day, making sure that patients and providers have all of the resources that they need. You might find her in the lab. She's also a certified diabetes educator, and so she takes really good care of our diabetic patients, those who are newly diagnosed or those who are struggling with their diabetes. She works really hard to make sure that our patients have the tools that they need to live well with their chronic diseases. So this is Brenda. And now I'd like for you to meet Melanie Douglas. She is our operations director, and she is really the bridge between our clinic and our pharmacy entities. They're under one roof, but they are two separate entities, and so she makes sure that everything flows smoothly and properly between the clinic operations and the pharmacy operations. You'll often see her behind the front desk on clinic day, getting patients' paperwork received and checked in, making sure that we are in compliance for all of our prescription programs that we participate in. And honestly, if there's anything broke around MLK, she's the one that we call. She's the lady with the hammer, both physically and metaphorically. So we're super grateful to have her on our team. So this is Melanie.
Hi. If you need help, just give me a call.
So we're now in the pharmacy, and I'm excited to introduce you to our pharmacy manager and garden coordinator, Jennifer Donner. Jennifer will often be back in the pharmacy on clinic day. She's the one that making sure that all of the prescriptions are filled, that the labels are correct, that any notes that we can add to our prescription labels to help our patients better understand their medications, she takes care of that. She does a lot of medication education with each patient to make sure that they understand the medications that they're taking, why they're taking it, and how often they're supposed to take it. And of course, she maintains our amazing garden learning center. So she wears a lot of hats around here, and we're very grateful to have her on our team. I'd like to introduce you to Skylar. She is our health promotion and marketing coordinator. She also runs our diabetes prevention program. Anything online, this video that you're going to be watching, any of our social media content, she is the master behind the curtain, putting all of this beautiful content together to help educate our community. And then, like I said, she runs our diabetes prevention program, and that is free and open to the public. So if you are at risk for diabetes and want some education to make sure that it doesn't develop into type 2 diabetes, be sure to give Skylar a call. So last but certainly not least is Miss Susan Perkins. She is our care coordinator, and Susan plays a very important role. So she helps navigate both patients and community members for services outside of MLK, because we know that patients and community members struggle with more than just their health. So if they're looking for any resources beyond the walls of MLK, she is the person that we go to get them connected to the help that they need. She also helps coordinate referrals off-site for patients who need procedures that we can't do on-site. And she is a wealth of information, and she's very invested on a lot of coalitions, and we're really grateful to have her a part of our team.